Today, I'm at Valley Health Hospital in downtown Phoenix. I'll be getting an inside look at their COVID unit alongside a COVID-19 nurse. As of this morning, the hospital reports 10 unstaffed ICU beds with just one staffed ICU bed available.
What I see is the worst of the worst of the worst.
Kendall Gribbler is an ICU nurse at Valley Health Hospital in Phoenix. She works in one of their 4 COVID units. She's been in there since March.
I feel like it's pretty overwhelming. We don't always have adequate staff to care for these critically ill patients.
With 12-hour shifts in a makeshift negative pressure room, she enters through an antechamber area full of personal protective equipment and decontaminating products.
Which means that as a staff nurse or anybody that comes into that unit has to wear their PPE the entire time they're in there.
Gribbler has 2 red blisters on the bridge of her nose. She wears a silicone half-mask respirator with a face shield over it, paired with a gown, hairnet, and 2 pairs of gloves.
I had come out for a break to eat my breakfast, 15 minutes maybe, half an hour at lunch, a couple water breaks, but like most of the time I'm in there the whole day.
I watched through a glass window as she worked on patients who were on both ventilators and dialysis machines.
There's not been a whole lot of cases or patients that I can recall off the top of my head that once they're on a ventilator, get off the ventilator.
I asked her what the most difficult part of her job has been since the pandemic began.
I think one of the hardest things that I did was hold somebody's hand while they're getting their last rites over the phone. Yeah. It's hard when their families can't be there for them. So essentially you're like their family.
With over 9 months in a COVID unit, Kendall took 2 weeks off of work for Christmas to visit her parents in Minnesota. That trip now canceled with another surge in cases. Allie Vettner, KTAR News.
Here's our top story.
KTAR News, 92.3 FM, Arizona's news station.